mode.
Okay, thank you.
Yes, Dr. Shetu, you can start now.
Okay. Can you see?
Yes, we can see. Please start.
Welcome. Assalamu alaikum. Good afternoon. Welcome to our Bangladesh Kurgan Fellow Group. Hope you are all in safe and staying at home with good health. At first, I will pay my respect to all corona fighters and always respect my teachers who made me an orthopedic surgeon as well as Ilizarov surgeon, especially my mentor, Professor Dr. Muhammad Mofakkarul Bari, and to my hospital director, Professor Dr. Muhammad Abdul Ghani Mullah, great patronizer of Ilizarov surgery. Before starting my session, I just mentioned few words regarding Ilizarov. Now it is established that Ilizarov method or technique is the lifeboat or jacket of an orthopedic surgeon. Only by this method, we can achieve fracture union, control infection, correction of deformity, correction of limb length discrepancy, and improve the bone quality. So, we should discuss about this technique and its biomechanics. We have to learn it properly and meticulously, and its appropriate application also. For this reason, we think about this webinar session from very beginning, like ABC of Ilizarov and its basic thing. We will try to share our own experiences also. Now, let us go to the session. Gabriel Abramovich Ilizarov. He is the inventor of Ilizarov method. We should always respect him because his invention opens the new era in orthopedic world. Basic Ilizarov frame and its components. And this is the main topics of our fellow group. We will discuss about this gradually. I am Dr. Nazmul Huda Shetu, Assistant Professor Ortho Surgery, National Institute of Traumatology and Orthopedic Rehabilitation, NITOR, that is situated in Dhaka, Bangladesh. It is the 1,000-bedded hospital. Previously I said Ilizarov method. Why we choose it? Because it is the method by which we can achieve fracture union, control in bone infection, correction of deformity, correction of limb length discrepancy, improve the bone quality. Yesterday, Dr. Arif already demonstrated his topics, main support components. I just review these topics very few slides. That is half ring, arches, long connecting plates. You can see the half rings. You can see the arches, different arches, Italian arch, Russian arch, pediatric arch, and upper femoral and pelvic arch that looks like banana, and sometimes it is called banana arch. Long connecting plates. You can see in the basket there is a long connecting plates, and here you can see an X-ray. The use of long connecting plates with the olive to translation of the long segment for the fibula, fibula transport for the tibialization of the fibula. You can see. My topics today, today's topics, auxiliary support components. Short straight connecting plates, curved plates, twisted plates, posts, male and female. There is a short straight connecting plates. You can see there is a lot of connecting plates, 4 holes, 3 holes, and 2 holes. 2 holes plates is oblong in shape and nicely constructed. And these usually this thickness of this plate usually 5 millimeter, wide of this plate 14 millimeter, hole diameter 7 millimeter. And these oblong plate is lesser thickness in standard connecting plates. Here is some use of straight plates. You can see the oblong plates used, and here is the smaller ring connected with the larger ring, adjusted with this short straight plate, connected with the connecting rod, threaded rod. Here is you can see clearly, and here is also you can see. It is nicely constructed and is a frame for the correction of the deformity of ankle and foot. Here you can see the use of straight plate. There are multiple use of post, hinge, and other things you can see. And here is also a straight plate that is connected to the larger ring, the smaller ring connected with the larger ring and adjusted with the straight plate. And here is the basket with a femoral arch, straight plate, oblique support, you can see. And here is another plate that is customized plate, locally made. It is more thicker than the normal conventional plate, and it has two holes at its two ends to connect the rods at its two ends. There are carved plates and twisted plates. You can see the carved plates, twisted plate, twisted over the 90-degree angle. There are a lot of twisted plate, one hole, two hole, etc. You can see here is the use of twisted plate. You can see nicely adjusted and used the twisted plate. And here is the carved plate. You can see a half ring connected with the carved plate to enlarge the size and adjusted with the half ring so that it is connected with the wires, sometimes rods, posts, etc. And here is also another carved plate connected with the two parallel rods. Posts. Two types, male, female. These are usually 28, 38, 48 millimeter long with 3, 4 holes respectively. You can see the post, male post, female post, one hole, two hole male post, two hole female post. And here is the another one female post connected with the threaded rod. Make a half part of the hinge, and this is the hinge you can see, and here is the 4-hole male post, 3-hole male post, 2-hole male post, and also the female posts. Use of post. These are auxiliary support element to fix wire rod plates at an angle to maintain support. Can be used as multiplanar hinges to lock the mobile joint to correct the angular deformity of the long bones also. Here you can see the use of multiple posts, hinge, lot of hinge, and also post adjusted with the connecting rod and adjusted with the rings apart from the ring. And here is the another picture, constructed frame for the correction of the ankle deformity, and nicely constructed. There are different parts uses, straight plate, post, and hinges also, you can see. And Ilizarov ring, there is multiple use of Ilizarov rings. You can see here the half rings only, and posts and hinges also. This is usually used for soft tissue management of leg and ankle of a child due to trauma. Here, Ilizarov will help a lot. Increase the circulation, control infection, less chance to fail the skin graft, prevent deformity, post-traumatic equinus deformity. Here only the half rings. You can see the half ring. Here is the half ring, and here is the half ring. Sorry for interruption. And another, just I want to show another picture. 65 years old male, open fracture, proximal shaft of right tibia fibula. You can see patient came to me with this external fixator with C-ring. And here is the X-ray, fracture upper shaft of tibia fibula, and treated by Ilizarov method. And is the old man, you can see, nicely constructed frame. Use here is the post and drop wire also, and also the thread telescopic rod also here. You can see. And lastly, after 2 months and after 3.5 months after removal of Ilizarov ring, nicely united. Another female patient, 55 years old, 1.5 years old, non-union fracture shaft of distal shaft of femur, and treated with the Ilizarov method. And here is the use of Italian arts, half pins or shunts, and oblique support. The olive also used here. The patient is doing his physiotherapy, and after 3 months, you can see the bones is uniting, and she is waiting for removal of Ilizarov. And lastly, I want to say compliance of the patient will be excellent if it was properly and meticulously applied. You look, a very beautiful girl with the Ilizarov ring is playing and jumping. And this picture is taken from Kurgan. And another picture, you can see a 3-wheeler puller with the Ilizarov ring, and patient has no complaint. He is doing his daily job. If the frame is constructed appropriately, there is no problem with the patient, and patient compliance is very good. This patient was done by Dr. Arif, you can see, and my mentor, Professor Muhammad Mufakkar al-Bari, and in front of Ilizarov Center with the Kurgan Fellow. And monsoon is coming. This is the beauty of Bangladesh, you can see. And lastly, thank you all, and inviting you all to the next session. Hope you will be with us. Thank you. Arif, you can, Arif, we cannot hear you.
Just thank you, Dr. Nazmul Huda Shetu, for your nice and brilliant presentation, especially your clinical experience sharing slides and the X-rays that help us a lot for making decision about the Ilizarov and patient-friendly Ilizarov technique from your corner. And now I am asking everyone, do you have any question? Please send me message in chat box, or you can hands up and I can unmute your microphone, then you can communicate with us. Before going to the question session, I want to tell something that the cyclone Amphan is approaching to the coastal area of Bangladesh. It is the number 10 danger mark is hosted in the coastal area. So everyone please pray for our country so that this cyclone will be a weaker one and there is no disaster in our coastal area. And if you have any question, please hands up, then you can question directly to the speaker. And before the question session, I want to just hand it over the microphone to my professor mentor, Professor Bari. Please pass some comments about this session, because today we have lots of time. And thank you, Dr. Shetu, once again. He very time oriented and completed his lecture in a very good arrangement of time. So now the Professor M.M. Bari. Sir, please, for some comments.
Can you hear me?
Yes, sir, we can hear you.
No. Thank you, Shetu, for a good
Thank you, sir.
explanation.
Thank you, sir.
Well said, well said. So, and at the same time, the use of the auxiliary parts, how to use that, what to use, and which place to use, you have shown that one from your clinical experiences and from your patients. And of course, you could not mention anything regarding the telescopic rods, auxiliary parts, bolts, nuts. You have shown that one. If you could say that one, that will be better. Okay, otherwise, everything was good, nicely said, good explanation, and picture was very good, very nice. And I think those who were looking at all this, they had taken some idea from your lecture. And it was a good lecture regarding the auxiliary parts of the Ilizarov apparatus. And everybody should know it before applying any kind of Ilizarov surgery. And I always tell Professor Ilizarov, and at the same time, Professor Shetu was always telling us that no surgeon is justified to do any Ilizarov surgery, simple or any complicated case, if he or she doesn't have any competent idea regarding the technique and particularly the apparatus. If you don't have idea, you'll face a lot of problems in the operation theater when you change your mind, what to do. If you don't have any apparatus, any extra parts, if you start your operation with very simple, limited things, then you'll face a lot of problems and you'll not get satisfaction. And outcome of the result will be poor. So thank you very much for sharing your cases and presentation. Thanks to Arif and other Kurgan fellows and other those who have joined here to learn Ilizarov. And think yourself, you can apply in orthopedic surgery, in trauma surgery, even Ilizarov, not in orthopedic trauma, in urology, in gynae, in neurosurgery, everywhere. You should have to know the principles. And whenever you apply it properly, then nobody will tell you that this is the cumbersome. Cumbersome, not for the patient, cumbersome for the surgeon. The surgeon who doesn't know how to apply and the principles of the Ilizarov and the philosophy of the Ilizarov. This is the main thing. Ilizarov is a very big thing. Not that they're putting the word, this is the Ilizarov. It's a very big thing. And you can solve 85 to 90% of the trauma and orthopedic problems with this single technique. Am I correct?
Yes, sir, definitely. Yeah.
Thank you, sir.
Thank you very much. You continue then. Question.
And now the question session. And one thing for your current information, sir, we have divided the auxiliary part in the two part of the lecture. The next part of the auxiliary part that will include the telescoping rods and other things, and it will be delivered by me on tomorrow, and it will be the last session before Eid from our Kurgan basic Ilizarov session group. The next session after the Eid, it will be 27th of this month, and hopefully you all will be with us, stay connected and give the opinion. So far, I have not seen anyone raising his hands. So I just randomly pick some foreign delegates or participant for your kind opinion, please, or just connected with the Bangladeshi doctors, especially to me, doctor, and the other Kurgan fellows and Professor Bari. And now I am just unmuting the microphone. I have seen here the Dr. Rajesh Likhi, maybe he is from India. Just please, sir, can you, if you can hear me, just pass some comments about this session, sir.
Sir, thank you, sir. I am from Nepal.
Oh, sorry,
it was a very good session.
From Nepal.
Sir. Thank you, sir. Thank you, sir, for Professor Bari also. I'm very grateful. Thank you, sir.
Rajesh, welcome you to this session, and please stay connected. because
Yes, sir. Thank you.
our motto is that we are working in a very basic level, so that those who are beginner, those who want to build a career in Ilizarov, so have some
Sir.
knowledge, and it will be a good platform for future knowledge and communications between the orthopedic surgeons. So
Sir.
Stay connected. And do you have any
Thank
question?
You, sir.
Do you have any question, sir?
Sir, not at the moment. I'm with thank you, sir. Thank you, sir.
Okay, sir. Okay, now I am picking another one. Please, Dr. Edwin, can you hear me? Dr. Edwin, can you hear me?
Yes, I can hear you.
Yes, sir. You can communicate with the speaker and my professor Bari sir and with me, and please pass some comments about the session if you have any advice regarding our session and how can we improve, because we have some technical issue also. Please pass some comments, sir.
Thank you very much, Dr. Arif. I am very glad to be associated with this webinar by the Bangladesh group. Indeed, our Nigerian our counterparts in Nigeria here brought this brought the Bangladesh program to our notice, and those of us who are just beginning to express interest in Ilizarov found it very interesting. So I am glad that I am part of this initial lectures, although I came in late for this particular one, but I know that from what I saw, it's wonderful. And our group in this country, in our country, who have pioneered Ilizarov in our country, they have shown us some things like this, and in fact, it's very exciting. So that is why some of us are getting interested in this Ilizarov, and we want to. We wish that the Bangladesh group will offer us a very good hand of fellowship to help to strengthen Ilizarov practice in Nigeria. Thank you very much.
Definitely, sir.
Thank you.
You are welcome here. And I want to convey a message to your Nigerian colleagues that please, many Nigerian doctors are added with me in WhatsApp. They are very kind. Every time I send them message, they just reply me with thanks and always very generous to reply me. And I am very thankful to the Nigerian people for their kindness. And now I am just searching another foreign participant in my list. You can communicate with me. Another from the Chinidam Ite, if I am right. Sorry, can you hear me, sir?
I hear you, Arif.
Yes, sir. Sir,
thank you very much.
Give some advice that how can we improve our sessions, because it's a very long session. It will be up to the 26th of June, and there are many more things to come, and very interesting, and especially the Kurgan diaries and other things will come on the later on. So, sir, please pass some comments about our session, sir.
Well, I have to commend you guys for putting up this lecture series, especially the fact that you're using a bottom-up approach, starting from the basics and taking it higher, making people to understand the biology and the principles eventually in the later lectures to come. It's very basic what you're doing, and it's quite fundamental and necessary, in the sense that whoever wants to practice Ilizarov should know the basic principles, should know the assembly of instruments he or she is going to deploy during the procedure. I think so far you've communicated very well to the participants, and to some of us who are listening in, it's not a new terrain, because some of us also do Ilizarov techniques in our various practice. And just like my senior colleague Edwin said, we also have a lower limb reconstruction society of Nigeria. And from time to time, we run courses. We've not been able to run courses this year because of the COVID-19 pandemic. Last year and the year before, we have done courses on both basic and advanced reconstruction. Thank you very much. You guys are doing a great job. And I must say that you keep it running. Congratulations.
Thank you, sir. Please stay connected with us. And now I am choosing to some of the audience from my country, Jamil Jahidur Rahim. He is a very old and good friend to me. And Jamil sir, can you hear me? Jamil sir, can you hear me?
I can hear you. I can hear you.
Yes, sir. Please pass some comments about the session, sir.
Yes, it's a very nice and very precise webinar. I think every Ilizarov fellow will be benefited from this webinar. I wish your best luck and it should be continued. Thank you very much.
Thank you, sir. And I am just handing over the microphone to Shohid Yaqub sir, because when I am in the controlling panel, I have seen that Shohid Yaqub sir have very difficulties in connecting frequent by several number of times he hit for approach. Shohid Yaqub sir, can you hear me, sir? Shohid Yaqub sir, can you hear me? Yeah, Shohid Yaqub sir, can you hear me? Okay, I think we lost the connection. And now I am just, because we are at the end of the session, because we want to finish this session in just 40 minutes today, because Dr. Nazmul Huda Shetu do a tremendous job that he completed all the things within time. And now I am switching one of our Kurgan fellow, Dr. G.A. Munir. I am unmuting him. Please pass some comments and your feelings about this session, because we have some couple of minutes. Dr. Munir, can you hear me?
Thank you, Dr. Arif. Can you hear me?
Yes, sir, I can hear you.
Yes.
Okay, thank you. Thank you, Bari sir, and all the Kurgan fellows. I am hearing the, I am following the webinar from the first day. For the current and the electricity, I have some disturbance in following the comments and the lecture today. It is very useful for us, and we hope then we will continue the session nicely. Thank you all.
Okay, okay, I am just at the end of the session now. I will hand it over the microphone to my professor, just saying goodbye to all. And before that, there is an announcement for all the Kurgan fellow and Professor Bari sir, that after this session, we want to have a video chat in this Zoom platform for 10 minutes for some necessary advice and necessary meeting. So please stay connected, and all the Kurgan fellow, don't be disconnected. And now I am handing over the speaker to microphone to Professor Bari sir, and please end the session. And before that, one thing, that tomorrow the same time, same session, and the last session before Eid will be presented by me, the other component of auxiliary supports. So now the Professor Bari sir.
Thank you very much for a good talk. Thanks all those who have joined here, and especially thanks goes to you and our Kurgan fellows and the foreigners, those who have given their advice for this. Of course, this kind of session especially the webinar in this pandemic situation is very good for the learners, for everyone. Those who are the expert, they can also revise their every teaching, every time, all the time. And hopefully for the last 3 sessions, everything was good. And I hope coming days, the program will be good. And my advice is to all the participants, please continue your support all the time. Thank you very much for your kind attention.
Okay, sir. Now I am ending the session, and please, the Kurgan fellow, please stay connected on the next session.
Okay, thank you. Thank you all.